Welcome back to the News at Noon for this Medical Monday, and Dr. Aswa is joining us here today. And noses.
Noses.
That's the topic.
That's right. Rhinoplasty is one of the top 5 common procedure in the country. Cosmetic procedure, I would say. But there are some people that they are not candidate for surgery because of the general anesthesia, or it's a very small area that it could be improved just by in-office 2 minutes procedure without any incision, that we call it liquid rhinoplasty.
And that's what we're seeing here.
That's right. The reason that we call it liquid rhinoplasty, we inject some sort of fillers, hyaluronic acid, into the area that professionally we can improve the shape of the nose. Usually for the area that have, for example, a dorsal hump on the area of the nose. Or people, they already have rhinoplasty in past, and they pretty much not happy with certain area. For revision, we don't go back and do the surgery. Some area we can do it in the office.
We have a couple of examples of this here.
That's right. The courtesy of our friends, and actually see that area the patient has a dorsal hump.
Okay.
What we do, we inject 2 other areas to create a straight nose, as you see.
So instead of taking out the hump there, you're literally filling in these 2 spots to get it to where that level is.
That is correct. But we have to know the anatomy.
Right.
This procedure has been performed by some non-professional, and they have created disasters.
Oh my goodness.
This is the area that if you don't get it by a professional, board-certified plastic surgeon, or somebody who doesn't know the anatomy, there is a high chance of bad complication. But on the other way, when you look at it, I have multiple patients who perform routinely in my office. It's just injection. The cost is pretty much even less than $1,000. And the patient is happy immediately. They see the results. And
we have one more photograph to just really illustrate this. I mean, it's pretty striking, but it's not permanent.
It's not permanent. It depends on what kind of filler do you use, and the length of the life of that filler tells you how long this gonna last. Usually it's about a year. This patient, as you see, very large unwanted dorsal hump. When we inject on the above underneath that one, you see the straight nose. You see the shape of the tip of the nose has not changed. The angle has not changed. But overall the shape, and the patient is happy, and this is an in and out in the office, and we perform it.
Sounds like a winner for a lot of folks. Celebrate where they can find more information.
Well, my office, of course, they can call the office, all the information, my website. But remember, if it doesn't done by a professional, they can lose part of the nose, because if they inject inside the vessels, that's a disaster. We can fix it, but it's difficult to fix it.
Well, we want to make sure we don't have those disasters.
That's absolutely correct.
That's the important part. Thank you so much for coming in.
My pleasure.